Comprehensive, relevant, and insightful conversations about health and medicine happen here on MedStar Health DocTalk. Real conversations with physician experts from around the largest healthcare system in the Maryland, D.C. region. According to the CDC, an estimated 58.5 million U.S. adults have been diagnosed with some type of arthritis. Arthritis Awareness Month is observed every May, and it's a time to inform people about this complex group of debilitating diseases. Welcome to MedStar Health Doc Talk. I'm Ryan Miller, and I'll be your host for today's episode. Our goal today is to educate our listeners about the importance of arthritis, how to promote lifestyle changes for prevention, and highlight the importance of research and support for those living with the condition. And to do that, we're joined by Dr. Michael Kessler, Chief of the Division of Hand and Elbow Surgery within the Department of Orthopedic Surgery at MedStar Georgetown University Hospital. As a member of the MedStar Orthopedic Institute, he performs surgeries at MedStar Georgetown University Hospital and the MedStar Surgery Center at Lafayette. Thank you so much for coming on MedStar Health Doc Doc.
Thanks for having me today.
So we'll just jump right in and have you start with the types of conditions that you treat and you see.
Sure. Thanks very much. The nice part about being a hand surgeon is that we have the opportunity and ability to take care of a variety of conditions throughout the upper extremity. In fact, it's one of the few specialties within orthopedic surgery that allows us to take care of babies, children, teenagers, adults, and senior citizens. We're able to take care of conditions with respect to repetitive use injuries, such as tendinitis. We take care of athletes who injure themselves and get them back to playing their sports. We take care of professional musicians to get them back to their work. We take care of folks with arthritis who are having difficulty getting through their normal activities of daily living. And our goal, obviously, is to restore people to as much function as we can so that they can return to their lives doing the things they love to do.
You've seen pediatric patients as well, starting at a young age.
Yes, my line that I use is my age range that I take care of is birth to death.
That covers it. For those who don't know, could you just give us a general overview on what is arthritis?
Sure. Arthritis can be caused by a variety of things. Some are autoimmune conditions such as rheumatoid arthritis or psoriatic arthritis. And probably the most common type of arthritis that we see is osteoarthritis, which is the generalized wear and tear that occurs in a joint over time as we age. As you know, there's cartilage at the end of our bones, and that allows the ends of two bones to rub against each other without friction and allows our joints to move smoothly. When that cartilage wears down, then the bone is exposed that lives underneath the cartilage, and when bone starts rubbing on bone without that cartilage buffer, we develop arthritis and have pain with motion of the joints.
And we have cartilage throughout our hands and wrists?
We have cartilage in every joint of our body, and in fact, the reason that joints move so smoothly is that when cartilage rubs on cartilage of another bone, the opposing bone in a joint, it's actually slicker than ice rubbing on ice.
Interesting. How do you diagnose and treat arthritis?
So the two main ways that we diagnose and treat arthritis involve physical exam and typically X-ray. X-ray gives us a 30,000-foot view of what the joint looks like and allows us to understand the alignment of the joint. In other words, how one bone is lined up with respect to the other bone in the joint. Lets us see if there's increased or decreased space in the joint between the two bones, and allows us to see if there are any bone spurs or any malalignment or dislocation of the joint where, with respect to where it should be lined up. On physical exam, we can see if there's any extra fluid in the joint. Sometimes our body will create more fluid to make up for the fact that there's no more cartilage to try to lubricate the joint and make it more smooth. So if you ever played that game Operation, there was the water on the knee, and that was because someone's knee is swollen, and that's because the body is trying to protect the bones from rubbing on each other, causing pain, and so it will make more fluid in the joint to help it be more lubricated.
That's probably the origin story for a lot of surgeons, huh?
Yes,
Operation.
That's right.
I read that there are roughly 100 different types of arthritis. How many do you see? You've already ran through some of the common types. Do you mind walking us through those again?
Yeah, so some arthritis, like we talked about osteoarthritis, is something that's common and occurs through generalized wear and tear. Once the process starts, it will continue with chemical changes within the joint, and it will continue to degenerate the neighboring cartilage, and the cartilage will wear away on both sides of the joint. That's one of the reasons why doing a cartilage replacement does not particularly work for arthritis, because it's a problem within the whole joint. The whole milieu of the fluid within the joint is compromised and is not giving appropriate nutrition to the cartilage within the joint. Other types of arthritis are autoimmune, such as rheumatoid arthritis, which is significantly more rare than osteoarthritis, but it is a very debilitating condition and something that people are very concerned about having. Frequently, people remember their grandparents or great-grandparents as having, gnarled knuckles or deformed hands, and were told by their grandparents that they had rheumatoid arthritis and are very concerned that they themselves are developing rheumatoid arthritis. But it is a specific set of criteria that are required to diagnose someone with rheumatoid arthritis, including blood work, lab values, x-ray changes, again, physical exam findings. And it's usually a combination of diagnosticians, including rheumatologists and orthopedists, that help to come to a decision as to whether you technically have rheumatoid arthritis or not.
Can that be genetic, rheumatoid arthritis?
Yes, it can be genetic. Other things that are possible is psoriatic arthritis. Psoriasis is a condition where you have dry skin or plaques on your skin that is diagnosed by a dermatologist. And that condition is associated with developing a certain type of arthritis in the hands, but also in other parts of the body. But again, that also involves blood work and biopsies in order to appropriately diagnose that. There are other conditions that can lead to arthritis that are not specifically causative of arthritis. And what I mean by that is, for example, people who have lupus, which is not an arthritic condition, develop laxity of their ligaments that support the joints. And so when the ligaments are not supporting the joints appropriately and they become too loose, the joint surfaces slide across each other rather than staying in their normal congruent alignment. And so since the soft tissues aren't supporting the joint, the cartilage then gets worn away with this uneven wear and they develop arthritis. So that's more of an outside-in version where the problem starts with the soft tissues and eventually becomes a joint problem, as opposed to it starting within the joint as it does with rheumatoid arthritis or osteoarthritis.
Thank you for breaking all of that down. When it comes to developing arthritis, we usually associate it with senior citizens. Have you seen younger people have arthritis as well, and how severe can it get?
There are some specific types of arthritis that affect children, and those are types of juvenile rheumatoid arthritis, again, exceedingly rare. The other type of arthritis that we haven't mentioned yet that can affect younger people is something that's called post-traumatic arthritis. And again, this is another form of osteoarthritis where the cartilage has been injured or damaged, and then over time, that damage continues and wears down the joint further. So sometimes there's a fracture of a bone, and the bone is no longer straight when it heals. So that then means when the joint is moved to accommodate for that fracture, the joint is not rubbing in a, again, congruent way. And so with the cartilage sliding across each other in an uneven way, it wears down and then people develop arthritis. So it is possible for younger people to develop arthritis, but typically there is some sort of inciting event that causes it. More commonly, we see arthritis in older folks, and as I get older, older means older over time. But whatever your definition of older is, we see people develop it after having used their body and used their joints over a period of time.
You mean those kind of athletic people, or people that have physical demanding jobs?
It can be that. We see athletes, we see certain types of arthritis develop in certain types of athletes. Like, for example, for people who lift heavy weights, we sometimes see arthritis in the elbow, which is a not very common place to see arthritis, unless you have another condition like rheumatoid arthritis. As we don't typically walk on our hands, our upper extremities are not used to dealing with heavy weight. So when people are very involved in heavy weightlifting or bodybuilding, we sometimes see different types of arthritis in the upper extremity that we don't normally see because those joints are being overused. I tell patients, when my grandmother was 65 years old, she was already a grandma and wasn't doing very much. Nowadays, patients who are 65 years old are still very active, very youthful, hiking and climbing and walking and doing all kinds of running marathons, doing
pickleball,
Yes, lots of pickleball. All kinds of activities that, 20 or 30 years ago is something that people wouldn't say, oh, when I'm 60, I'm going to still be doing X, Y, or Z. So we are seeing people who want to stay active, want to keep mobile, and over time, there have been surgeries and surgical implants that have been developed to allow patients to maintain mobility rather than what was done previously, where it potentially would limit mobility or limit function just to remove pain.
I did just have a question pop up as you were speaking there. Is carpal tunnel a form of arthritis, or is that a different condition? Can it lead to arthritis?
So carpal tunnel syndrome is a pinched nerve in the hand/wrist. It does not come from arthritis and does not cause arthritis. It causes numbness and tingling in the thumb, index, and middle fingers, and is typically made worse when you're sleeping at night with your wrist flexed, or if you're doing something over a prolonged period of time, such as driving a car, holding the steering wheel, or holding a hair dryer, or talking on the phone, if you still hold your phone when you talk on the phone. But it's unrelated to arthritis.
Thank you for that. When it comes to the symptoms, I imagine, your body starts telling you when it's wearing down, so it probably presents very quickly for your patients.
Correct. So symptoms of arthritis tend to be pain with range of motion. Sometimes people say they feel some crunching or grinding or clicking and popping when they move their joints around. Some people will say they feel like they're losing some range of motion. They don't have the full extension or flexion of the joint that they had previously. And some people feel like when they move in a certain position, their joint gets stuck and they feel like they need to pop it, like you would crack a knuckle or something, in order to feel like they can achieve further motion because the joint feels like it's stuck.
Dr. Kessler, when should a patient come to you for an evaluation?
I think that patients should be evaluated for arthritis when they start to feel the symptoms of arthritis or when they have a concern that something is different than what it was before. Again, range of motion, strength, pain, weakness, anything like that. The easiest thing for us to do is to check a physical exam and take an x-ray to either alleviate their concerns and let them know that, yeah, there's a little arthritis, but nothing particular to worry about. Maybe they can take some anti-inflammatories or try a little physical therapy to try to improve their symptoms. Or potentially there might need to be some type of an intervention in order to alleviate the symptoms that they're having.
How do you decide whether to take a surgical approach or a conservative treatment plan for a patient?
That's a good question. I think in general, even though our title is orthopedic surgeon, we try to avoid surgery in people as often as we can. We know that when we use implants in surgery, such as a knee replacement or a hip replacement or something like that, that it has a certain lifespan. Sometimes it's as long as 20 to 30 years, but it still has a lifespan. So we want to prolong the time that we can keep people with their own joints, their own cartilage, their own stuff, rather than replacing it with new stuff. We want to keep people with their range of motion that is natural to them, rather than limiting their motion from putting in some type of a device. In the fingers, we use silicone implants for joint replacements. Yes, we can replace joints in the fingers. We sometimes have to fuse joints, and that limits range of motion. So we try to keep people away from the operating room as long as we can. Sometimes that can be done with cortisone injections. Sometimes that can be done with bracing. Sometimes that can be done with physical or occupational therapy. But really the key deciding factor to when we offer surgery versus when we offer conservative management is how much pain the patient is having and how much that pain is limiting their activities, either required activities of daily living, such as bathing and cooking and cleaning and getting dressed, or activities of pleasure, such as pickleball or other types of activities that they like to do.
I assumed that you're always looking to do surgery, but it was interesting to hear you say that that's not your first instinct when evaluating a patient.
Right, because, I do love surgery and I love operating, but, part of the way I work and the way my partners work is we understand that if you are a surgeon, there will be complications, right? We hope to keep those very low, and we do in our department, luckily, keep them very low by following the rules and making sure we're up to date on the most current literature. But we know that at some point there's going to be a complication. So by lowering the number of people that we operate on or being very stringent with our indications about who we operate on will help us keep our complication rate low and keep our patient satisfaction rate high.
You've been in this field for a number of years. What does the future of orthopedic surgery look like? Would you say there's reason for optimism?
Yes, I've been here for 14 years, and I think that the future of orthopedic surgery is quite bright. First of all, we're entering a time when a lot of patients are entering a period of life when they are going to need orthopedic surgery. As the baby boomer generation ages, there is going to be a significantly higher number of people with symptomatic arthritis than there has been in the past. In order to treat this, there have been many surgeon scientists and companies that have been working on new implants and new devices in order to allow people to maintain their lifestyle while still being able to remove pain and decreased range of motion related to arthritis. Sometimes this involves novel materials. Sometimes this involves using current materials in a novel way. And sometimes it involves something totally new and thinking outside the box from how things have been taken care of in the past.
Well, it sounds like there's a lot of exciting things on the horizon. You have provided care for a variety of professional sports organizations. Is there anything someone can do to improve their hand strength?
That's a good question and something that I get asked actually pretty often. Hand strength actually comes from the forearm. We don't have any muscles in our fingers, and we have some muscles in our hands, but the majority of the muscles that control our fingers and affect our grip are in our forearm. So really the main thing is to stay active and to stay using your hand. It's pretty difficult to specifically strengthen your fingers or strengthen your grip strength, but to be able to use your fingers for normal activities, opening jars, doing different things around the house can be helpful just with overall health. There are commercially sold grippers and other types of squeezy ball things.
So you don't recommend everybody have a stress ball, right?
Right. I mean, sometimes a stress ball can be helpful, but maybe it's just throwing it against the wall. But I think any of those things, if it's keeping you moving and it's not causing pain, can be helpful. So if that is something that helps you by squeezing a gripper while you're watching TV or working on finger dexterity by playing the piano or typing or doing things like that, all of those things can be helpful to hand strength and activity over time.
That's good to know. What would you say your philosophy of care is?
I would say my philosophy of care is to try to return people to the level of activity that they want to return to with as little intervention as possible.
That's a great goal to have for sure. Why should a patient choose the MedStar Orthopedic Institute for their orthopedic surgery?
Yeah, that's a great question, and one of the reasons why I chose to come and work here. The MedStar Orthopedic Institute has representation from every type of orthopedic subspecialist that exists. And so we all know each other, and we all are able to consult each other. We are all able to facilitate appointments within our department. I mean, every day that I see someone who has a problem with their hand, wrist, elbow, what have you, and they mention, by the way, I have a foot problem or my friend has a shoulder problem or so on, we love to keep things within the family. We trust our partners operate on our family members, and we all take care of each other. And so, we would welcome our patients to join our family.
Well, that's wonderful to hear. I've really learned a lot in my conversation with you, so thank you so much for your time. I have been talking with Dr. Michael Kessler at MedStar Georgetown University Hospital in Washington, D.C. Thanks again for sharing your expertise with us today on MedStar Health DocTalk.
Thank you very much for having me.
To book an appointment with Dr. Kessler, please call 202-444-0659.